I'm very excited to be part of this. For me, it's a birthday of many. I can't wait for us to be talking about the 10-year anniversary of this kind of symposium. So well done to the team that has really put it together. I'll go straight to the point, but my name is Joli Ntusi. Sorry, I'm rushing now. And project manager for Key Population. I'm the third musketeer, and my bit is really going to discuss gender-affirming healthcare training that we've been involved with, working with trans-led organizations. Specifically, I'll be discussing the work that we've worked with GDX, Gender Dynamics. I think you all know Gender Dynamics. They don't need no introduction. So,
Joli, may I interrupt you and ask you just to move on to slideshow presentation, please?
Yes, thank you very much. I was just going to do that now. Thank you, Naomi. So I'll just go straight to the, honestly, if you hear everybody's conversation, it is to do with gender-affirming health care. And I've been documenting how many times we've been talking as all the speakers have been coming in. Every conversation has gender-affirming health care. And the culture and the clinical competence is really needed. It's an urgent need in South Africa at the moment. And I will be discussing that. And I'll also be looking at, so really the sensitization, and we need the knowledge. We need to increase the awareness and the technical skills for the healthcare providers. So I will be talking to the work that GDX and us have worked on, but just briefly, we were very lucky and privileged to have funding. It's called KPIF, it's Key Population Investment Fund by USAID in 2019. It is part, as part of just an addition to already committed PEPFAR funding that we already have as VITS-RHI. And so this was really great. And the reason we had that was really to work with the key-led organization, community-based organization. And this was just 2 years. So it started in 2019 and 2021. And the goal of KPIF was to achieve accelerated HIV epidemic control among key populations. And in doing so, it sought to strengthen the capacity of local KP-led organizations. The organizations we worked with, I'm just going to jump into them just now. I think I have them somewhere there. We worked with 7 NGOs. And just zooming into the ones that the ones that are just transgender focused is SHE and I think you all know SHE and GDX. So, and we, amongst others, we also had sex worker organizations such as SWET, Sonke, we worked with PHRU and many more. So I'm not going to go into detail of the organization, but with the KPIF project, we had 7 organizations that we work with. Specifically for transgender was Gender Dynamics and GDX. It's really a joy to work with organizations that already know what they're doing and pushing the agenda of really making sure that trans people receive holistic care. So the GDX, with GDX, amongst other services that they provided, the key one was to make sure that we do provide these workshops, gender-affirming healthcare workshops and sensitizations to the clinical teams. And this includes hormone therapy over different, across the whole country. Actually, it wasn't just specific; it was across a whole country. So I'll just zoom into the kind of. I'm just gonna think my slide. Yeah. So the methodology we use, so here we are. So we made sure that before we can do that, we'll do a pre and post training. And this is just an example here of the pre and post trainings that were done. And it was very interesting. And as you see, even my next slide, you'll see the results, how much knowledge people know about gender-affirming healthcare training, and before they were trained and after they were trained. And you're asking, so when I say who and how, and we're just talking about healthcare providers, it is really, we trained a lot of psychologists, it was a lot of social workers and a lot of medical doctors across the whole country. And also the model, and because it was also during COVID time, we had a hybrid model where we would do online training via Teams, as well as a face-to-face, just to strengthen the work they've already done online. So the results were just outstanding, and good people across these 2 years. GDX just alone in collaboration with us, VITRHI, 134 healthcare providers were trained. And if you look at how many people, just to think about, just an example, and how many nurses we've got in the country. And I just got this from Sanka. I just Googled this from Sanka, and we've got 280 nurses. And if you ask all the nurses, have you been trained in gender-affirming healthcare training? The answer is no. And these are the people that we really need. So it is really a dire need. We also have a lot of doctors, and I think in South Africa at the moment we have 28,000 doctors registered according to Sanka. I stand to be corrected with this data, but it is really a drop in the ocean of the work that we've done, and we need more hands. And when I was listening to Dr. Bruno, I was almost emotional about it, because there is a lot of work that needs to be done, and it needs to be done indeed not at a primary health. This is really a basic primary health care need. And as we trained at the target that we were given, or we told ourselves we're going to train 160 people, and we overachieved our target by 134%. We trained 215 people. Again, this is just a drop in the ocean. Imagine how much more if we put our hands together, how many people can be trained and sensitized. And the best, if just look at, I shared with you the pre and post. So our pre and post results all show that before they had 45% knowledge, and after the training, they had 95% knowledge. So there is a lot of work that it is working. We need more of these trainings to go on. So in terms of recommendations, in my conclusions, really, it needs to be community-led, nothing for us without us. And the work that GDX and the likes, the organizations, we need more VITRHIs, and we need more GDX, we need more SHE, and we need to be the vuvuzelas until, we need to speak until cows come home, and in terms of making sure that the training and the people are sensitized. We need to scale up, again, just to echo what I've already said, but more importantly, community partnership. How nice would it be that in this symposium, we've got a lot of people from different corners of the Department of Health, all these key policymakers. We need to really continuously knock at those doors, and in the community, all the way up to the stakeholders, all the way up pushing the agenda in the parliament. So, and also continuously seek for funding. I know Dr. Bruno talked about resources. It is really critical that we have these resources. If we're training, there's need for funding for that. There's need for those social workers training, or social workers that are going on the ground. There is need for funding. So we need to continuously seek for that funding and not knock at all doors. And at the end of the day, we need to be sustainable and stand on our own feet as community-led, trans-led organizations, and be able to stand on our own feet and support our people on the ground. So we have not stopped as VITRHI, and we are saying that yes, KPIF ended in 2021, but we have continued working with partners in the small way we can. We're still continuing working with SHE in sensitization workshops. We've got choices, and we've got different dialogues that are happening, especially in East London. We've got GDX really continuing with gender-affirming healthcare. We're not going to stop. We're going to continue. We're also working with GDX on React platform that really focuses on human rights violation of transgender people. We're still working with SWEAT in terms of just creating enabling environment for sex work and peer educator training. We're working with Sisonke, who are really very key people in terms of outreach teams and referrals of our services, and conducting creative space. So it is really an honor to continuously work with the community CBOs that we've been working with. And I want in the next session to say, we've got more than these, and we've got more funding to do so. Just really to share one of the success stories. This is, and I've been given permission to share this. This is one of the students, a third-year medical student who was part of the training, Neha Prague. And they say that, and I'm going to open quotes now, I'm certain that gender-affirming healthcare training I received will remain with me forever, and as such, exponentially assist me to improve the quality of services I'll be providing to my patients in future. So this is really something that's really encouraging, that we're working with students that are going to be the future Brunos of this, and the doctors coming up more. We could not have done this without without PEPFAR funding. We could not have done this without support of our gender dynamics, for example, or our LGBTI community, and all the Eastern Cape government. We're really not an island, and we still continuously need to do this block to be more people to come and really work with us on this. I thank you.
And thank you, Joli. That was really a lovely end to a beautiful trilogy of presentations there. Thanks to all the presenters for the last 3 sessions, papers. I'm going to open the floor, even though we're in the tea time right now. Perhaps if you can maybe just entertain a few questions from people here, and then we'll, with your permission, if we can then go into the tea break after that. So yes, anyone with any questions that they'd like to present, ask the presenters? So while you're gathering your thoughts together, maybe Naomi, I had a question around the way in which you focused or presented social work and its role in looking at a more public health facing model, and looking at taking the models or your learnings that you have toward a national level. So I'm specifically interested in the way you're looking at social work, and as a profession, how can social work demonstrate the ways in which it develops a public health model for other similar professions, perhaps, maybe? So as an example, as an exemplar of a profession looking more towards public health models.
Mershan, I'm sorry, I didn't hear the middle part of your question. Were you asking me how social work could...
So I didn't, so when I was listening to it, I thought, oh, that's really interesting, the way you positioning the profession. And I thought, well, can other professions do similar things, other healthcare professions? Arguably, there are people who are thinking this, but I'm thinking, for example, as a speech therapist in my profession, I'd be keen on learning more about how you develop your model. So what are some of the ways in which you could use your engagement to perhaps maybe exemplify how professions can rethink their role in a public health space?
Mershan, that's a big question. So, I mean, I think that some of the thoughts that came to my mind as you were asking it was that, I mean, we've said, and that's why Joli and Rue and I sort of plan to present our presentations together, because they do speak to each other. And I think that, as Joli had said, I mean, if you look at the numbers of healthcare professionals and mental health professions in the country, we need to get training into the universities and training institutions. We're not going to crack this by only training people who are already practicing. So I think that changing young minds, but also making sure it's part of the curricula, is really important. So that would be my first point. I think that the second point would be, in all of the existing professional training programs and CPD points, we need to bring in a lot more consistent training of the likes that Joli was describing. And I think that in our sort of communities of practice as professionals, I mean, most geographical spaces or hospital spaces have interdisciplinary networks of professionals. And I think that we can really leverage there to share lessons learned in terms of how we are developing our competencies and our skills and sharing them with each other. And also, I think, looking at task shifting. As I mentioned, I mean, we know that we have a very, very limited number of psychologists, for example, but there are areas of this social work scope of practice that, merge well with psychology. And I think it's the same across this whole area of the helping professionals, with the use of paraprofessionals, and even where appropriate of volunteer counselors. We can make sure that services are made available more broadly, and that the professionals are working at a particular area of specialization. And that speaks again to the model which Ruth showed with the triangle, and making sure that everybody is doing their own work within their particular layer of specialization. So those are some preliminary ideas. And I mean, lastly, and I shine the light on ourselves in saying this, we need to write up and document the work that we're doing, and we need to publish, and not only in academic literature, which we know has a very critical and important audience, but also in the grey literature and in the professional literature, so that, you know, the on-the-ground experience gets out a lot more broadly. So I hope that's given some ideas in response to your question, Mershin. Thank you.
Definitely has. Thank you so much, Naomi. Alison's put a question in the chat, and I'll read it out. Alison, are you able to ask, unmute yourself and ask it? Okay, I'll read it out. You're probably unable to do that for now. So Alison says, I'm wondering if there's any integration of lived experience into the multidisciplinary team on an ongoing basis. Do you employ community members to work in the healthcare spaces? You mentioned the peer support, educators, trans agents, but are they the only ones doing outreach in the community, perhaps as care navigators or real-time subject matter experts working with clinical staff?
Thank you, Alison. I'll take it, and I'll also leave it to Naomi and Joli to perhaps add in. I think, Alison, that was one of the things that I mentioned as one of the challenges that as a program, we are very much acutely aware of, that within our multidisciplinary team, the trans agents or the transgender people with the lived experience are usually the outreach workers or the care navigators. We are endeavoring as much as we can to make sure that at least within the sessional doctors and the sessional psychologists, we do employ trans or gender diverse people. Our peer educators are care navigators in terms of linking transgender people to care, following them up, and making sure that they return to services. And then I just wanted to see what else she's mentioned here so that I know I've answered everything. Yeah, so they are working very closely with the clinical team, our trans agents, and in terms of the whole gender-affirming care and hormone therapy, they are working very closely with the doctors and with the psychologists. But as I mentioned, that we have very few who are in more senior roles. Thank you.
May I add a comment, please, to Ruth's comment? So what we also do is that when we advertise for positions, we do advertise to our technical advisory group. There are a number of people on this symposium who are part of our technical advisory group. And we have in the past also shared some adverts with Part SA. So I also want to appeal to people on this group that, you know, I would really love the opportunity to be able to share any adverts for vacancies regularly. And I'd also like to motivate Mershin that it's something we all do between ourselves, so that we make sure, firstly, that people who are skilled in this area or bring lived experience to the field know about the opportunities that exist, and that we can help each other to fill positions most appropriately. We very soon, in fact, in the last 10 days, have advertised for a senior technical position. We've indicated we really would like to find somebody from the trans and gender diverse community for community engagement. So this is also just an opportunity to put a flash advert. Thank you.
Well noted. Thanks for saying that, Naomi. I'm going to ask one more question. If there's, are there any other comments or questions? I can see something from Chris. Okay. Also, another plug for Path SA as a platform for advertising. Just a last kind of quick question. Hopefully, looking at cultural and clinical competencies that you spoke about, Joli. I know that there's a general shift in looking across health professions to move away from competence and to think around cultural safety. And I just wondering what your thoughts were around that. And it is a little bit linked to what has been spoken about just now about the lived experience issues. So in other words, as healthcare providers, we may never achieve competence because of our own lived experiences. And the best we can sort of hope to do is to be safe with our client populations. Just thought if you had any thoughts on that, or if that's part of the discourse around the competence issue.
You just hit the nail on the head, and I think I will not actually have a full answer for you. It's a buzzword right now. We will never reach indeed full competency, and at what level do we say we've reached it? But again, the word safety and just really making sure that we are empowered. So it is a conversation and a buzzword. I was speaking to Anil from GDX, and we're looking at even incorporating that culture into the trainings that are happening. And we would never reach, and if anybody reaches the competency level, then be afraid that we actually, we can never reach there, but we need to keep going. We need to keep going, and we can't get to a level where we're comfortable. So we need to knock at all doors and make sure that we're all competent, quote unquote, at whatever level we can. And your competency may not be my competency, but we are competent, and that's what's critical, and indeed safe with it. Thank you.
Thanks very much for that.
Could I just throw in a very quick one-liner, because I know we're going into tea. I mean, in the space in which we work, particularly in the Department of Health space, there's an enormous call for sensitization training in those terms. And sometimes it's an hour session, and then it's like a tick box exercise. Well, everybody now is able to provide gender-affirming healthcare. And so I think what we were also trying to show, and I mean, your points around the terminology are absolutely well taken, is that there's values clarification, cultural safety, and there's also within the clinical arena, specific skills, as everybody on this team knows, I mean, skills and approaches and knowledge that one requires, which is not just about the very basic so-called sensitization. So we were trying to, within the Department of Health space, make apparent that nurses need to understand about particular health issues that, say, a trans woman or trans man might experience, not just to be able to deal with these sort of more social gender-affirming issues. Thank you.
Yeah, sure. Thanks very much for that.